As we've worked together over the last few years, I've learned from you that there's a huge amount of variation in the amount of radiation and dosage that patients may receive from a particular test, depending on how it's done and where they go to get it done. So how can patients, once the decision has been made to go ahead with the test, how can they assure that they will have the lowest possible dosage that's necessary?
The patient should ask everyone they interact with to ensure that they're getting the lowest dose possible. And that means when they go in, usually the person they see at the beginning of the testing is the technologist. And the truth is the technologist has an awful lot of knowledge about how to minimize radiation dose. You know, I'm having this chest x-ray today, I'm having the CT scan today. It's really important to me that you use as little radiation as possible. Can you tell me if that's possible? Can you tell me how you're going to do that? And I think patients would assume that the technologist is going to do that anyway, and they're not. Simply asking will then motivate the technologist to do several things, to use different choices on how to do it. It will motivate them to call the radiologist and say, can we do it this way instead of that way, and that will lower the dose. So I think that is number one. And I don't want to be naive and pretend that all technologists will respond positively. I think many will and some won't. But often tests get ordered, for example, in an emergency room setting where there's an opportunity to talk to the person ordering the test, the ED physician, to say, look, can you order a test that has the least radiation possible? So can you tell me what my dose was? You can ask, can you tell me what my dose is likely to be? For a CT scan, the technologist can answer that question. It's printed on the CT scan before the scan.
That's really interesting. I didn't know that the technologist would be having the ability to say how much radiation a particular test provided a patient.
Another thing that patients could ask for is to have the test be as limited as possible. I think it's important for patients to understand that all tests are not equivalent. Some tests can be done with very little radiation, but end up getting done with really high doses of radiation. I think that's why it's really important to keep track. A chest x-ray does not have a lot of dose. A CT scan does. They're not equivalent. So you don't want to keep track that I had 2 tests last year. You want to keep track of I had this low dose and a high dose. Similarly with mammography. Mammography tends to be a low dose study. You don't want patients to think, oh, I've had 3 mammograms this year. I've had a really high exposure. I can't get this other test. So I think all tests are not equivalent.
We've talked about individual tests, but some patients, particularly if they have chronic conditions or difficult to diagnose conditions, may have multiple advanced imaging tests over time. Should they be concerned about the additional effect of multiple tests? Is it cumulative?
In the end, every decision should be based on, will this test help me now? As opposed to, there's a limit I've reached that I can't go beyond. There is no limit. There's no absolute cutoff. I think for people who have a lot of tests, they have to think about them a little more carefully because they're getting up higher in numbers. But I think it's just, do I need this particular test? And I think for patients who get a lot of tests, they should just become even more strongly advocating for only getting tests they need.
I think patients tend not to think of tests as having the same dangers as might be true of having an operation. And if they think about them a little bit in the same way, then it might help them to be confident that they should ask about those risks.
Leif, it was such a pleasure to have you share your insights with us. Thank you. Really appreciate your time and sharing your knowledge.
This has been wonderful. I've learned as much as I hope the patients might from seeing this video. So thank you very much.
Thank you. Really a pleasure.